Hi, I'm here with Cynthia K, and I just have a few questions for you about your career. So, first and foremost, what is your job title?
I'm a surgical technician,
And is there any other kind of name for that?
a scrub nurse
Okay, thank you. And where is it that you work?
at Soch,
The one right up in here.
right in Manahawkin, right by Southern,
And how long have you been employed at Soch?
since September.
Oh, okay. And what are your responsibilities as a scrub nurse or a surgical technician?
I have to keep a sterile field. I pass off all of the instruments to the surgeon. I help retract things. I put things together. I have a septic technique. I gown and glove myself and the surgeon. I am in charge of medications. And that's it.
When you say retract things, do you mean like retract body parts?
I mean body parts, intestines, fat, muscle, tissue,
Tissue. Is tissue
blood
hard to
clots.
retract?
No, it is not.
Are blood clots tricky? Like, because they travel?
No, they're not tricky.
um, what's your favorite part about the job?
Um, I enjoy helping people by making them better through surgery
Okay. That's very nice of you.
and learning about the anatomy of people's bodies and how and why things go wrong.
Wrong in what way?
Like if you have to get your gallbladder taken out, you don't eat good. If you have to get a lap band, you're fat. If you have to have a cardiac bypass, it's because you have a heart attack because something went wrong in your heart.
Have you had to do a cardiac bypass yet?
No, Soch does not do those.
No. Please don't do that on my laptop. Do you plan on furthering your career at Soch as a surgical technician?
No, I do not.
What do you plan on doing?
I plan on going back to school to be a nurse and then hopefully go to Jersey Shore and work
Is,
in the ER trauma center.
is Jersey Shore your main hospital of choice?
In New Jersey.
Okay. Um, have you faced any challenges thus far in your career,
Not yet, but I'm sure many will come.
such as like people dying on you?
People dying. That's pretty much it, really. Aneurysms.
What is an aneurysm?
Like a big, huge blood clot makes you have a seizure. Internal bleeding.
Is internal bleeding like messy once you open up where it
It's like
is?
a river of blood in between your bowels.
It's adorable. Um, um, has anything that you've done freaked you out?
I had to take hemorrhoids of some lady's butthole.
Appropriate. um, was that more disturbing or did it just freak you out?
It was highly disturbing. What freaked me out was a C-section.
Really?
I did not enjoy.
Why?
It was disgusting. I can handle blood, but that was disgusting. I do not like babies. I do not like them crying. I do not like them coming out of a human being. I do not enjoy them.
Okay.
And C-sections are weird. They distort your body in many ways that should not be
Distorted.
humanly possible.
Um, what are your goals for the next 5 years besides like becoming a nurse? Like, I understand that you would like to go to Jersey Shore and become a nurse, but how do you go about doing so?
I would have to go to Stockton. I would have to go there for 4 years to get my bachelor's degree. Then I would have to go work in a NICU, child hospital, general hospital, ER, and then I have to go back for 2 years to get my master's to be a nurse practitioner, and then I would work at another hospital, depending on where I wanted to
Now,
go.
when you say that you have to go do all those things in different places, are those internships or do you take those on as jobs and then go from there?
Take them on as jobs and go from there. You have to switch each department. You have to be in each department for a year.
Okay. If somebody were to
That's
ask
just to
you,
get your master's degree, though.
and then what do you have to do after your master's?
Pick a field to go into.
Oh, okay. Um, if somebody were to come up to you and ask you your advice on a surgical technician or scrub nurse, what advice could you give them? And would you recommend the job to them?
They would have to have a tough skin because surgeons will throw things at you. They will scream at you. You will stab yourself. You will get blood all over you. You will have to touch intestines. You will have to see disgusting things you do not want to see. You'll have to touch things you don't want to touch. You'll have to do things that nobody should have to do. You have to see people who don't take care of themselves. You have to.
Is that sad, seeing people that don't take care of their bodies?
Partially, but when it gets to a point, they just don't care anymore. So it's like
Why
deliberate
should you care about them?
neglect. What?
Nothing. Continue.
That's it.
Okay. Thank you for answering all of my questions, and I wish you luck in your career.
Thank you.
You're welcome.